Hello, everybody. I'm Dr. Vipul Janardan. I'm psychiatrist at Institute of Human Behavioral Allied Sciences. So I will be talking about sleep disorders. So so sleep disorder like dysomnia are primarily sleep disorder, which cause difficulty getting off to the sleep or remaining in to the sleep, or excessive sleepiness. These are divided into primary insomnia, primary hypersomnia, circadian sleep disorder, narcolepsy, breathing related sleep disorder, sleep state misperception. Whereas parasomnia disorder, which include the sleep process, are subdivided according to the phase of the sleep. These are associated. These are like arousal disorder arising from the non-REM sleep or NAREM sleep. These are confusional arousal, sleepwalking, or sleep terrors. Whereas the sleep walk transition disorder includes sleep starts, sleep talking. Uh, and similarly, in this order, there is RAM sleep parasomnia, RAM behavioral disorders, and nightmares and sleep paralysis. Uh, ICD stated that sleep related, also like in the movement disorder, sleep related movement disorder like restless leg syndrome, periodic limb movement disorder, and sleep related bruxism. So ICD-10 includes the sleep disorder like non-organic insomnia, non-organic hypersomnia, non-organic disorder of the sleep-wake schedule, sleepwalking, sleep terror, or nightmares. In this, there is first we will talk about circadian sleep disorder. So, alteration of the sleep-wake cycle may be a sign of the circadian rhythm. It may occur in the jet lag or shift work. In delayed sleep phase syndrome, most common circadian rhythm problem. The patient is usually falls asleep until very early morning. As time progresses, the onset of sleep become progressively delayed. In this order, there is one more is narcolepsy. Narcolepsy, a prevalence of 0.025% is seen in the general population, and symptoms include excessive daytime sleepiness, sudden sleep attacks, or narcolepsy. The sleep is refreshing in the REM in nature. Cataplexy can be seen, or sleep paralysis, hypnagogic hallucination, which is the like pathognomic of narcolepsy. Autonomic behavior is also reported in one third of the population, or the one third of the narcolepsy patient. The overall of sleep duration per 24 hour is not increase in the narcolepsy due to reduced and fragmented nocturnal sleep. It can be either familial or sporadic, but there is a strong association with HLA-DBQ1 uh, gene association in almost all the individual regardless of ethnicity. Abnormal low concentration of the hypocretin or orexin A is noted in the CSF. Sleep polysomnography often shows latency of less than 10 minutes with sleep onset rapid eye movement. A multiple sleep latency test is also helpful in supporting the diagnosis of this. Another in this line is obstructive sleep apnea, or OSA. Obstructive sleep apnea is more common in men compared to the women. A history of loud snoring, breathing pauses, mouth breathing, restless sleep, increased perspiration at the daytime sleepiness, morning headache, behavioral changes. These are the same things that can be seen. Right-sided cardiac failure may occur in the untreated patient. Sleepwalking is described as a partial erosion from sleep during the slow wave stage 3 and 4. It is most common during the initial third stage of the sleep period. And another one is a night terror. So night terror is an abrupt awakening or from the sleep characterized by panicky scream with intense fear and autonomic arousal. The individual has no recall of the event, date or any other detail of the event. unresponsive during the during that period. Night terror occurs during the first third of the night and during the third and fourth stage of the non-REM sleep. uh, in another thing is non-REM sleep behavior disorder. Normally, REM sleep is associated with loss of muscle tone and dreaming. In RBD, there is a no muscle tone, and the dreams are acted complex behavior. Patient act out of the dream, they with limited awareness of the surrounding, and may have a violent or dangerous consequence that result in the physical harm. The episodes are arise during the middle or later third of the night during the REM sleep. It is associated with loss of normal atonia of REM sleep. It may occur idiopathically or associated with a disorder like Parkinson's disease, diffuse Lewy body disease, multiple system atrophy, or GB Guillain-Barre syndrome. RBD may be a prodrome of the neurodegenerative disease such as DLB or Parkinson's disease. It can precede the diagnosis of the movement disorder by several years. It is likely to be associated and lesion that are situated in the brainstem. Treatment of all this is generally the clonazepam that has to be that is effective, making the sleep environment safe or universal sleep hygiene following the. And according to the ICSD diagnostic criteria include movement of the body or limbs associated with the dreaming, and at least one of the following criteria: potentially sleep behavior dreams that appear to be acted out, and sleep behavior that disrupt